most of you are familiar with this so-called statin, right? It's a very commonly used medication to reduce cholesterol. It's beneficial reducing the death rate because of heart attack, And we doctors are also trained to prescribe this statin for patients to take daily, thinking that they are life-saving. But is this really the truth? You can see from this statistic that the prescription of statins is actually increasing over the years. And despite all these prescriptions to hundreds of millions of people, there's actually no convincing evidence it actually results in a reduction in death because of heart disease in the population. As you can see here, cardiovascular disease is still number one killer globally. So to understand why heart disease did not really end with statin, we need to understand this important risk factor of high cholesterol. So historically, we understand that heart disease is because of this arteriosclerosis, which is the blockage. And they found that there's a lot of bad cholesterol is deposited in this plaque. But this is just like saying that just because we found this LDL in the crime scene, right, we just assume that it's the criminal. Studies actually show that 60 to 70% of those who had a heart attack actually had a very low level of cholesterol. From what we know from studies and in our experience, that this arteriosclerosis actually is a disorder of inflammation and clotting. According to this cardiologist from UK, Dr. Asim, showed that the real root cause of heart disease is actually insulin resistance and systemic inflammation, and not actually the cholesterol. Yeah. So these two are actually the main risk factors that leads to heart disease.